It was the first on the list.
Okay, so the whole thing is in the front.
Yeah.
So afferent is coming in.
Well, let's talk about the afferent on this model.
So then,
well, but you can see on here, if it's coming in of the glomerulus,
Yeah.
then it would be what?
Afferent.
Afferent. And if it's leaving, you can see is some of this leaving coming in here,
Afferent.
and it's leaving, so that will be efferent. So this out here will be the efferent because it's leaving, but this one you can see clearly in here that it's coming in.
Yeah.
Okay. And the next one we have to know.
The tubular capsule.
Okay, the particular capsules
Purple.
is on the book is purple, and it's margin when it's exchanged between the the red and the blue. So I think it's somewhere here would classify, like number 77 right here is where it classify as the periptubular capillaries. So it's where two of different well, let's say this where the vein and the artery exchange. So it could be a good way to describe it.
And the vasorectal is the one it's not on there.
And then next one we have the vasa recta, which is we can't find here.
And here it says
but,
it's between. Wait.
But you can see this on this one. It's kind of surround the loop pelon, right? It's kind of surround.
It might just be
this. See, it's look like it's around this.
There's the purple part that's around there.
Yeah, I think it's around that. You see, it's kind of living from the which one did we talk first? The pepribular. So it's kind of like the pepribular leaving. It's gonna go along and follow, and it's gonna go surround this area. You see, surround this area where it's gonna take the stuff in and out. And also on the chapters when we talk about this, right at this area of the loop pelon, that's where the salt and the water come in and out. So I think there's a reason why they list there, so they can maybe absorb the water and the salt come in and out of it. So that could be one reason why it was around this area. So supposedly there's supposed to be a vein going on around here, but you don't see it. But there's supposed to be a vein going on out there. What's the next one?
Glomerulus. It's just
yeah. This the whole thing here is the glomerulus. Yeah, and it's on this model. You can see this tiny little circle dot on here. It's class. This one is like a bigger version of it.
We skipped the next one.
And we forget about talk about the afferent. It's going this way here. It's going in. You get filter out, and water and metabolic waste going out, and then it's living on this side. So it's afferent. This is the afferent artery, and
we didn't get the.
Which one?
Bowman's capsule.
Where's the Bowman capsule? Okay, so the
Bowman
glomerulus is the Bowman capsule. There's just a different name for it. And we will have the next one. We have the loop-pelon, the descending and ascending. And usually, the descending is a thin one.
What about the proximal?
Oh, well, let's skip the proximal now because we can discuss the proximal in the next one. When we talk about the proximal and distal together, it makes more sense if we talk about that together. But first, talk about the loop-pelon. Is you can see this descending one is usually how you classify the descending one is the descending one is the thin one. So you can see on this line is thinner.
And the center is
So this one is the descending, and this one is thicker, and usually the thicker one is ascending one. So thinning is descending, thicker is ascending. And then we talk about proximal. So if we look closely to this pictures here, and you can see that it starts from here, go all the way around here, and then go all the way up here to the glomerulus. So this area, which is the farthest from the glomerulus, would call
distal.
the distal. Distal convoluted tubule. And the closest to the glomerulus, probably around here, is the proximal convoluted tubule. So proximal is here, distal is from here. So the kind of name can give up a sound. And then you have the duct, the collecting duct, which is the very big one. So this is the collecting duct, is the biggest one. This is where all the urine was get deposited out. And then we have the major, what is that called? Calyx?
This one, the major calyx.
Okay, the major calyx and minor calyx. There's one thing to notice about this one is the major is bigger than minor. And on the model, on this model, I can show that right here, the tiny little one hole right here is the minor. In here is a minor. Here is a minor. And big thing out here is a major one. It's where to collect all the urine. And this, so you see, there's a minor here, there's a major out here. And this is also the renal pelvis. That's where they deposit out. And yep, and that's it. Okay. So the external nares is basically the nose area or anything before the larynx. So we talk about the. Let's talk about the larynx first. The larynx is this right here. It's classified as number 5, or this entire structure is the larynx. And we have the next one is the
Epiglottis.
okay, epiglottis. There. So this thing here, and it's used. Yep. Okay. And we have the glottis. Did we look at the glottis?
It is.
Oh, you think that? I think that one is a glottis, actually.
So the opening part is the glottis.
Okay, this is the opening part in here.
Yeah,
This is
that's the
glottis,
glottis.
and this epiglottis.
So it prevents this from.
Okay, and we have thyroid cartilage.
Oh, thyroid is. Would be
This is
outside.
by the big one here.
Did we
And
do
then-
hyoid bone? Is that on there? It's the whole thing is hyoid bone. So you should ask that.
The higher bone is up here.
Oh,
But it's never
yeah,
in.
yeah.
Then they have cricoid cartilage, which is here, this one, right under the thyroid cartilage. And they have the next one. What's the
Arytenoid.
Arytenoid cartilage.
Which is this thing.
Yeah, it's if you look,
Like this part,
yeah,
yeah.
this part, not little part here, but this entire part there.
And then next would be the corniculate cartilage,
Yeah,
which is
corniculate cartilage is right here. As
Teeth right
you
here.
see, it's number it's G right here. It's a very tiny one, and then the other one is number 4, which is the artenoid
yeah,
cartilage. And then we have a tria, which is the entire thing here, trachea.
trachea.
So this also this model is trachea right here, and then you have the bronchial, and then the bronchioles are gonna set down here, and we have primary and secondary. Primary is number 3 right here, or 7. You can see this one is the right lung, this one left lung,
Right lung has 3 lungs.
and then well we get there. But this one is primary. This is secondary. This one is split up right here. As you can see, is 9 right here is classified as secondary. So primary, secondary,
Tertiary is the third one.
well, it's not on here. And then on the lung, we're gonna talk
tertiary.
about the.
It's the third one.
Well, that's when you go to bronchial. Is it go? Okay, I think that's going deeper than that. So, well, or I can say, yeah, the pterygiums would be the very last one, right? So it would be these guy here, this small guy here. We can see, and what is the next one? Transverse. The transverse fissures basically cause horizontal fissure. So they basically, I think, the same thing, and they kind of go. They only have on the right side.
No, wait, I thought we said the oblique was. No, you're right.
The transverse only on the right side, and they go across. And you can see why it's named horizontal, because it go horizontal, and it separates the superior lobe and the middle lobe. And on the oblique fissure exists on both of them, on the left and on the right. As you see on this line right here, says oblique fissure on the left, oblique fissures on the right, as over here, which separate the middle and the interior on the right lung. And we have here superior. This one is only exists on the right side of the lung. There's a superior, middle, and inferior.
I know where the cardiac notch is. Is this one right here?
Okay, so and this is the cardiac notch.
Give space for it.
Okay, there's a space cardiac notch.
Yeah, I can see the hearts in me.